Hello, Mrs. Smith. My name is Nick. I am a pharmacy student here and I wanted to discuss a few things about some of the new medications you are starting.
Hello, nice to meet you.
One of the new medications you are receiving is Lovenox 30 milligrams to be injected twice daily. What did your physician tell you this was used for? And how do you plan on taking this medication?
It was given to me to prevent my blood from clotting. I am not sure as to how I am supposed to be taking it.
Correct, because you've just had hip replacement surgery. You are possibly at risk for developing blood clots and this medication is meant to prevent that from happening. This medication may be a little different for you since you have to inject it yourself, so I'm going to go over that process with you and give you this guide to take home with you in case you want to go over the process again.
Thank you.
First, you want to make sure to wash your hands. You want to either sit or lie in a comfortable position to where you can see your abdomen. You want to choose a spot about 2 inches from either side of your belly button. You then want to use an alcohol swab to clean the area and let it dry. Take the cap off of the syringe and set it aside and then hold the syringe like a pencil. Next, you're going to pinch the area of skin that you swabbed and then insert the full length of the needle into your skin at a straight, 90-degree angle. With your thumb, push the plunger until the syringe is empty. Pull the needle straight out and while pointing it away from yourself, push the plunger again and that will retract the needle inside of the syringe to keep it from sticking you or anyone else. Then discard the needle in a sharps container.
Okay, thank you. That is nice to know, as I had no idea on how to do the injections.
You are welcome. What do you expect from this medication?
Other than preventing clotting, I have no idea.
I want to go over a few of the side effects you may experience. You might experience some pain in the area where you are injecting the medication. To help alleviate this, you should alternate the areas where you're injecting the medication. Because this medication thins your blood, you may notice some signs of increased bleeding, bloody nose, bruising, bleeding gums, cuts bleeding longer than usual, etc. These are normal effects of the medication, but if you notice anything more serious, please either call me or your physician. Also, because we are trying to prevent clots from forming, it is very important that you don't miss any of your doses. If you happen to miss a dose, take it as soon as you remember but never take double doses. It could cause more problems taking a double dose than if you were to just forget taking a dose. If you have any falls or accidents, especially if you hit your head, make sure to call your physician even if you feel okay.
Understood. Thanks.
The next medication I want to discuss with you is Fosamax 70 milligrams tablets to be taken once weekly. What did your physician tell you this was used for? And how do you plan on taking this medication?
It was given to me to help with bone loss, and I do not know how I am to take it.
You are correct. This medication will help treat your osteoporosis, which makes your bones weaker and more susceptible to breaks and fractures. Fosamax will help make your bones stronger. The best time for you to take this medication is in the morning, about 30 minutes to an hour before breakfast. It is also important that you take this medication with a full glass of water. Make sure not to lie down for at least 30 minutes after taking this medication, which will help prevent irritation of your throat.
Interesting, thank you.
You are quite welcome. What do you expect from this medication?
I do not know anything about it other than what you have described to me today.
Well, some side effects to look out for are nausea and vomiting, constipation and bone or joint pain. If you have any serious jawbone pain or difficulty swallowing, call your physician right away.
Will do.
In order to ensure you fully understand what we went over today, could you please tell me some of the main points we covered?
Sure. The Lovenox is used to prevent clots from forming. I will inject according to how you explained and how it is explained in this handout you gave me. Also, it is important to not miss a dose, but if I do, I should not double up on doses. I should watch out for bleeding, and if I hit my head I should contact my physician. The Fosamax is to prevent bone loss, and I just take 1 tablet a week in the morning before breakfast, and I will not lie down for at least 30 minutes to prevent it from hurting my throat.
It sounds like you have taken a lot from this session. Those are the main points I wanted to cover with you. Now, what questions do you have for me?
None that I can think of right now.
Thanks for taking the time to talk with me. If you do come across any questions later, please feel free to give me a call. Take care, and I hope you are feeling better soon.